Thank you, Travis. Good evening, viewers, and welcome to tonight's regional news. Indigenous groups, environmentalists, fellow reporters, and family and friends paid tribute on Thursday to British journalist Tom Phillips and Brazilian isolated tribes expert Bruno Pereira, who disappeared in the Amazon 11 days ago and are presumed dead. Police said on Wednesday night that they had recovered human remains from a grave in the jungle where they were led by a fisherman who confessed to killing the two men. The remains are still being identified. The man had threatened Pereira for documenting illegal fishing in the remote Javari Valley bordering Colombia, police said. Through his reporting, Phillips, 57, became an international voice for the threats facing the world's largest rainforest, which is being plundered by loggers, poachers, illegal fishing, and wildcat miners. Pereira, a 41-year-old indigenous peoples advocate and former official of the government agency, was traveling with Phillips as he researched a book on attempts to save the rainforest when they disappeared on June 5. Survival International said Phillips and Pereira were the latest victims of a war being waged by Bolsonaro and his allies in Brazil's farm sector eyeing protected indigenous lands. The presidency did not respond to a request for a comment, but Bolsonaro tweeted condolences to the men's families without mentioning their names and attached a statement that praised Pereira as one of Brazil's top experts in protection of isolated and recently contacted indigenous tribes. Bolsonaro previously said the two men had been on an adventure that was not recommended and that due to his stories, the Englishman Phillips was disliked in the area. Phillips was an admired reporter in Brazil and a regular contributor to The Guardian. He also wrote for The Washington Post, The New York Times, and other publications during his 30-year career in journalism. We tell you now that the United States regulators on Friday authorized the first COVID-19 shots for infants and preschoolers, paving the way for vaccinations to begin next week. The Food and Drug Administration's action follows its advisory panel's unanimous recommendation for the shots from Moderna and Pfizer. That means U.S. kids under 5, roughly 18 million youngsters, are eligible for the shots, about 1.5 years after the vaccines first became available for adults in the United States who have been hit the hardest during the pandemic. There's one step left. The Centers for Disease Control and Prevention recommends how to use the vaccines. Its independent advisors began debating the 2-dose Moderna and 3-dose Pfizer vaccines on Friday and will make its recommendation Saturday. A final sign-off would come from the CDC Director, Dr. Rochelle Walensky. At a state hearing Thursday, Walensky said her staff was working over the Juneteenth federal holiday weekend because we understand the urgency of the American parents. She said pediatric deaths from COVID-19 have been higher than what is generally seen from the flu each year. The FDA also authorized Moderna's vaccine for school-age children and teens. Pfizer's shot had been the only option for those ages. And finally, the World Health Organization said it's creating a new vaccine sharing mechanism to stop the outbreak of monkeypox in more than 30 countries beyond Africa. The move could result in the UN agency distributing scarce vaccine doses to rich countries that can otherwise afford them. To some health experts, the initiative potentially misses the opportunity to control monkeypox virus in the African countries where it's infected people for decades, serving as another example of inequity in vaccine distribution seen during the coronavirus pandemic. The World Health Organization said the agency is developing an initiative for free access to vaccines and treatments that it hopes will be ready within weeks. The mechanism was proposed shortly after Britain, Canada, France, Germany, and the United States and other countries reported hundreds of monkeypox cases last month. The World Health Organization has described the outbreak as unusual and said the virus continuing to spread was worrying enough to convene its expert committee next week to decide if monkeypox should be declared a global emergency. Vaccines for smallpox, a related disease, are thought to be about 85% effective against monkeypox. That is brought us to the end of tonight's regional news. Thank you for watching. Back to you, Travis.